focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
A routine physical revealed a serious heart condition Dr. Jeff Neale didn't even know he had.
Heart was dilated because there was backflow of blood coming in from these two valves that I was born with.
Jeff, a colorectal surgeon with a busy practice, needed his aortic valve replaced, and soon. That led him to Dr. Joseph Lamelas, chief of cardiac surgery at UHealth.
His heart function was normal, but the ventricle was dilating. And that means that the valve was leaking for such a long time that it started putting pressure on the heart and the heart started to grow.
At only 45 years old, Jeff had no symptoms but was at risk of eventual heart failure. Dr. Lamelas performs a technique to access the aortic valve without opening up the chest.
It's a 5 centimeter incision that occurs between the ribs. This technique does not require breaking the ribs, so there's very little trauma to the chest wall.
The minimally invasive heart procedure pioneered by Dr. Lamelas allows patients like Jeff to be out of the hospital and back on their feet within days.
He is, I feel, the greatest to be able to do what he did.
With this procedure, 2 weeks later, 100% normal lifestyle, no limitations at all.
Fixing hearts is Dr. Lamelas' passion.
People ask me, what is my hobby? And I tell them heart surgery, because I eat, breathe, and live this profession.
Many of his patients send him thank you cards every year on the anniversary of their surgery.
And that's very rewarding. To see that is really very special.
Jeff is back home enjoying time with his wife and daughters and can't say enough about Dr. Lamelas and the UHealth team.
You have to seek out the person who you think is the best or is the best, and you do that. And then you find Dr. Lamelas. You can't argue with excellence, perfection, compassion, competence, all rolled up into one.